If you suddenly lose control of one hand, drop your toothbrush, fumble with your phone, or feel a strange tingling that won't go away, don't brush it off, because your hand might be trying to warn you that a stroke is coming. I'm Dr. Jonathan Myers, a stroke specialist with over 30 years of experience, and I've seen one quiet symptom, often ignored, change everything. The hand is directly wired to your brain, and sometimes before your face droops or your speech slurs, your hand is the first to speak up. In this video, I'll show you how to recognize this silent signal before it's too late, and how one man saved his life because he didn't ignore his hand. Let's start with the most overlooked and most dangerous clue your hand might give you before a stroke strikes: sudden numbness or tingling. Imagine you're lying in bed scrolling through your phone and suddenly your hand feels fuzzy. Maybe it tingles like pins and needles, or maybe it goes completely numb as if it doesn't belong to you anymore. Most people dismiss it. Maybe I slept on it funny, they think. But here's the truth. If that feeling comes on suddenly, especially without any clear reason, it could be a red flag from your brain. According to the American Stroke Association, sudden numbness or weakness in the face, arm, or leg, particularly on one side of the body, is one of the most common signs of an ischemic stroke. And your hand is often the first part to signal something's wrong because it's so sensitive and finely wired to the brain's motor cortex. Dr. Natalia Rost, professor of neurology at Harvard Medical School, warns that when numbness appears abruptly, especially in just one hand, you should not wait it out. She says it could be the earliest sign of brain tissue being deprived of oxygen even before speech or balance are affected. I've had patients ignore this feeling for hours thinking it would go away. By the time they came in, we had lost precious treatment time and sometimes the ability to fully recover. One of my patients, a 68-year-old man named Eric, told me he woke up at 2 a.m. with a hand that felt disconnected. He thought it was poor circulation. 3 hours later, he collapsed on his bathroom floor. By the time his wife called 911, the stroke had already done damage. That tingling, it was a whisper from his brain begging for help. So here's the takeaway. If your hand suddenly tingles, feels numb, or becomes clumsy, and it's only on one side, get help. Immediately. Don't wait. Don't sleep it off. Call 911. That hand might be trying to save your life. Now let's talk about a symptom that disguises itself as aging fatigue or even simple clumsiness: the sudden loss of grip strength in just one hand. Have you ever found yourself dropping your toothbrush, struggling to turn a doorknob, or unable to firmly grasp your coffee mug? If this happens out of nowhere and only in one hand, it's time to pay attention. Most people chalk this up to overuse arthritis or just getting older. But as a stroke specialist, I can tell you these subtle changes in grip strength are sometimes the first cry for help from your brain. According to a study published in the journal Stroke by the American Heart Association, reduced hand strength, especially when one-sided, can be a precursor to an impending cerebrovascular event. In fact, the dominant hand is often affected, and that's why people notice it when they suddenly can't write clearly or hold utensils steadily. The brain's motor cortex is like the command center for all voluntary movement. When a blood clot begins to form or a vessel becomes narrowed, one of the first things to be affected is fine motor control. That's why your fingers may fumble or your grip may weaken even before more obvious stroke signs appear. I remember one woman, Carol, age 71, who came to my clinic after nearly dropping a bowl of soup 3 times in one evening. Her hand felt weird, she said. A scan revealed she'd already had a minor stroke and was at high risk for a much larger one. Because she acted quickly, we were able to intervene. Today, she's back to gardening and writing letters because she trusted what her hand was telling her. So if your grip suddenly weakens or your hand becomes clumsy, don't brush it off. It's not nothing. It's not just age. It could be your brain struggling to send signals through damaged pathways. Get it checked, because when it comes to stroke, a weak hand today could mean a silent stroke is happening right now. Have you ever touched one of your hands and noticed it's colder than the other without any clear reason? Not just cool to the touch, but noticeably colder pale, maybe even slightly bluish. If that's happening in just one hand, it could be your body sounding a silent alarm. Not about the hand itself, but about your brain. When a stroke is forming, blood flow doesn't just slow in the brain, it can affect how blood travels through your limbs. And because your hands are some of the farthest points from your heart and brain, they're often the first to show signs of circulatory trouble. According to research published in the Journal of Neurology, Neurosurgery, and Psychiatry, sudden asymmetry in limb temperature, especially in the arms, can correlate with reduced cerebral blood flow, particularly in people with underlying cardiovascular risk factors. In simpler terms, a cold hand can mean your brain isn't getting the blood it needs. Let me be clear, having cold hands from time to time is normal, especially in cold weather or air-conditioned rooms. But if only one hand is persistently colder than the other, especially with no temperature change in the room, and you feel a bit off, don't ignore it. I had a patient named Frank, 66 years old, who came into the ER saying, "Doc, I don't feel right, and my left hand's been ice cold all day." His blood pressure was erratic, and within an hour he developed facial drooping. He was having a stroke. But because he noticed the early vascular clue, his cold hand, he came in early enough for treatment. That hand, cold as it was, may have saved his life. Your body whispers before it screams. So if one of your hands feels oddly cold, check the other. If there's a big difference and you feel dizzy, off balance, or foggy, act fast, because your hand might be warning you that your brain is in danger. You might be wondering why would a stroke, a brain emergency, show up in your fingertips? The answer lies in how your brain, heart, and blood vessels work together and where your hands sit in that delicate system. The hands are among the most sensitive and vascular parts of the body. Tiny arteries and nerves crisscross your palms and fingers, and they're closely linked to signals from your brain's motor and sensory cortex, especially the areas that control grip, fine movement, and touch sensation. When a stroke begins, especially in the right or left hemisphere of the brain, it can disrupt blood flow to these areas. The result? A sudden breakdown in how your brain communicates with one side of your body, often starting with your hands. According to a 2021 review published by the American Stroke Association, more than 60% of early ischemic strokes affect fine motor coordination or tactile sensitivity. And the hands are often the first to show subtle signs like clumsiness, numbness, or temperature change. Even more interesting, your hands are bilateral. You've got one on each side. That makes it easier to spot differences, especially when only one hand is affected. Let me give you a metaphor. Your hands are like two dashboard warning lights. If one suddenly flickers, becomes cold, numb, or weak, it might be warning you that the engine in your brain is misfiring. The nervous system is a two-way street. Damage in the brain can echo into your limbs. And when those echoes appear as physical changes in your hands, they may be the only signal you get before something far more serious strikes. The takeaway: don't underestimate small changes in your hands, especially if they come on suddenly, affect only one side, or are paired with foggy thinking, dizziness, or slurred speech. Your brain and your hands are having a conversation. Learn to listen. And speaking of listening, let me share with you the story of someone who did just that, and it likely saved his life. Let me introduce you to Mr. Harold Bennett, a 67-year-old retired electrician from St. Louis. A man of few words, Harold was the kind who didn't like to complain, especially about minor aches and pains. But one night in early spring, something caught his attention. He woke up at 3 a.m., not because of a noise or a bad dream, but because his right hand felt strange, not painful, not numb in the usual slept-on-it-wrong way. It was cold, weak. And when he tried to grip the edge of his nightstand to pull himself upright, he couldn't close his fingers properly. At first he brushed it off, but within a few minutes he noticed something else. His speech felt slightly off when he whispered to his wife. No slurring yet, just effortful. Most people would have rolled over and gone back to sleep. But Harold remembered a video he had seen a few weeks earlier about hand symptoms and stroke. It had said, if one hand feels strange, don't wait. Compare it to the other. Check your speech. Get help fast. So Harold did something that saved his life. He called 911 right then. By the time the paramedics arrived, 12 minutes later, his speech was slurred and the weakness had spread to his right arm. At the hospital, doctors confirmed a minor ischemic stroke was in progress. But thanks to his quick response, they were able to administer TPA tissue plasminogen activator, a clot-busting drug within the crucial treatment window. Harold not only survived, he recovered fully. No lasting damage, no lost mobility, no regrets. When I spoke to him weeks later, he told me it wasn't pain that saved me. It was my hand whispering something wasn't right. That whisper, if ignored, could have been fatal. Let this story be a reminder: when your hand sends a signal, don't wait for it to become a scream. Now let's talk about why acting quickly, especially at night or early morning, is everything. When it comes to stroke, every single minute matters because the brain cannot store oxygen. As blood flow is cut off, millions of brain cells begin to die each minute. According to the American Stroke Association, a person can lose up to 1.9 million neurons per minute during a stroke. That's not just a number, it's memory, movement, language, independence, all slipping away with each tick of the clock. So if your hand suddenly feels numb, clumsy, weak, or cold, don't wait to see if it goes away. Don't sleep it off. Don't wait until morning. Don't tough it out. Instead, follow this simple action plan. 1. Check symmetry. Compare both hands. Can you grip the same? Do they feel equally warm? 2. Speak out loud. Are your words clear? Do you feel sluggish or confused? 3. Grab a mirror or camera. Look at your face. Is one side drooping? Is your smile uneven? 4. Call 911 immediately. Even if you're not sure, let professionals decide. Do not drive yourself. Emergency medical responders can begin life-saving treatment on the way to the hospital, something you can't do alone. Harvard Medical School emphasizes that early stroke treatment within the first 3 hours can dramatically reduce the risk of permanent disability. But most people don't get that treatment in time because they hesitate. So here's my final advice to you. Trust your hands. They may be the first part of your body to feel the warning. And if they do act, because in stroke it's not just time as brain. It's your time, your life, your independence. If you found this information helpful, even just one part, please take a moment to like this video. It tells the YouTube algorithm that this message matters. And if you haven't yet subscribed to our channel for more life-saving insights, especially for stroke prevention and recovery. We post every week, always backed by science and always with you in mind. And most importantly, share this video with someone you care about, a friend, a parent, a neighbor. Because sometimes one shared video can prevent a devastating stroke. On behalf of our entire medical team, thank you for watching, and remember, your body whispers before it screams. Never ignore the signs. We're here to help you listen.